In ancient Egypt, one of the most outstanding progresses in the field of neurotrauma research has been documented in the Edwin Smith Papyrus, from 1600 BC, the first written documentation of brain injuries, the first known surgical treatise, and the first medical document in history. The Edwin Smith Papyrus portrays the understanding of neurotrauma and of other ailments, with mentions of the dura, cerebrospinal fluid, skull fractures with ipsilateral eye deviation and hemiparesis, temporal wound accompanied by speech disturbance, along with the first mention of aphasia due to cranial injury. The papyrus also showcased the symptoms and the diagnostic procedure in patients with TBI, along with the therapeutic principles and prognostic detailed in specific cases, including mentions of spinal cord injuries with categorization. Treatments included applying fresh meat, honey, or grease on the wound, dressing the wound for those without skull fractures, and positioning the patients upright. The case's presentation is well structured and follows a logical order, representing a possible guideline for the management of combating head injuries. The papyrus gives insight into the high incidence of TBI at this point in time, showcasing the fantastic observational skills of the ASU, their physician, who had responsibility for physical treatments. The papyrus is based on an examination, logical analysis, and deductive reasoning, and it portrays 48 cases of trauma by anatomic region, 27 of which are head injuries. The document mentions 4 sections: title, examination, diagnosis, treatment, and a classification of fractures into splits, smashes, compound comminuted, and comminuted and depressed. It was named after the American Egyptologist who obtained the papyrus. It is believed that the Greeks, including Hippocrates, knew the papyrus, as the observations presented in the papyrus were reintroduced during Greek times. However, the teachings of this historical document were furthermore disregarded until after the Dark Ages. The papyrus also documents the ancient practice of trephination. Historically, head trauma has been a good indicator of violence, with anthropological evidence revealing a decrease in violence with the establishment of states and professional armies, progresses which made farmers and city dwellers less prone to involvement in violent conflicts. From ancient remedies to modern neuroscience, the story of neurotrauma reminds us how far medicine has come and how curiosity has always driven healing. Follow us to learn more about the story of neurotraumatology, from earliest times up to modern day.